Good morning, everybody. Good afternoon, good evening, wherever you are. Welcome to ECCHR event series, Human Rights in Times of Crisis, of Resistance and Concrete Utopias. This event was actually planned back in 2019 together with our cooperation partner, the Federal Agency for Civic Education, obviously as an event in presence together with workshops, because even by that time we were aware that we as human rights organizations are facing a multiple and very complex global crisis, climate crisis, crisis of water, of food, growing authoritarianism, which requires a new discussion with new actors, with other actors than the very close human rights community. And obviously, with the current pandemic crisis, it became even clearer that a conversation is needed. We're hoping that at some point in the upcoming months, we will be able to fulfill our function as ECCHR to serve as a platform, as a hub for actors beyond Germany, beyond Europe, beyond law, an interdisciplinary mixed coalition of people. But as Alejandra Ancheta from Mexico said, we have to maintain our internationalist spirit, and so we have to bridge until this time has come. And so this is why we decided to aggregate one more online conference series to the endless series we're having already.
So I want to welcome you today to our fourth session in the series that Wolfgang just introduced. And today we will talk about the global right to health and the reality of COVID-19 vaccine distribution. I'm very pleased to have with me Andreas Wolf. He is a medical doctor and he started to work for Medico International as a medical project coordinator and global health advocate in 1989. In 2019, he became the first Berlin representative of Medico International. Since then, we are sharing an office, which is very pleasant. And he is also a board member of the Geneva Global Health Hub, a civil society network focused on global health and governance. I'm also very happy to welcome Mina Jagannat. She is director of the global program at Movement Lab. And prior to joining the lab, Mina coordinated the Community Justice Project in Miami, a Miami-based movement lawyering organization supporting campaigns for racial justice and human rights. She is a movement lawyer with an extensive background in activism and international human rights. She is joining us from the US, so hi Mina, good to have you here. And then we have Achal Prahabala with us. He's a public health activist based in Bangalore. He's the coordinator of the Access IBSA project, which campaigns for access to medicines and vaccines in India, Brazil and South Africa. Over the course of the last 19 years, starting with the AIDS-HIV crisis in South Africa, he has worked with nonprofits, governments, and multilateral organizations around the world on overcoming monopoly barriers on life-saving pharmaceuticals. Thank you also to you, Achal, for making the time and so late in India. So good to have you here. Today's session, we're trying to bridge a very wide range of topics, and we're trying to connect the current COVID crisis, which has a lot of complex issues and questions, combine this with the question of equitable access to vaccines and intellectual property rights, which are actually in the way of equitable access, and connect this to broader demands for social justice. And I hope that we will be talking about the role of global movements in the fight for global justice, while a lot of the debates and a lot of questions actually at least appear to be very technical and complex. We at ECCHR have not been really working on the topic of global health until the COVID crisis hit, where we once again felt, well, this is really an issue, especially for an organization based in Europe, that we really need to look at. And I think as we can see that the COVID crisis has worsened a lot of the global inequalities, but also the inequalities within societies, I think the topic of global health is one of those prime issues that that we cannot escape, and especially as human rights lawyers we cannot escape. Although probably or classically, for a lot of human rights lawyers, litigating the right to health is not necessarily something that is a very mainstream thing to do. And so that's why I'm also very, very glad that together with the Movement Lab, that is also something that this has been a collaboration over the last months, if not year, to really be thinking about how can we create also legal approaches towards this problem. But yes, so I think also to bring us and our audience to a little bit on the same page of this, to some extent complex issue, and then at the same time probably also not so complex, very obvious issue. Achal, you've been a health rights expert, as I just introduced you, for many, many years. Explain to us what is the current debate about the equal distribution of COVID-19 vaccines, and of course not only the vaccines, but also other medicines, and describe a bit of what's the current status of the debate. Also, probably around, I guess that's for a German audience very interesting, the mRNA BioNTech vaccines.
Miriam, thank you. Firstly, it's a pleasure, and thank you for having me. I've been working on this issue of access to medicines and vaccines for about 20 years, and the problem really began with the creation of the World Trade Organization in 1996 and the institution of a global regime for a peculiar kind of monopoly in pharmaceuticals, because it was a monopoly that was sanctioned by the law. It exploded late 1990s and the early 2000s with the HIV/AIDS crisis in sub-Saharan Africa, where AIDS drugs called antiretrovirals were priced at $10,000 per person per year. So you could live, if you were diagnosed HIV positive, only if you had $10,000 a year, which very few people, or no one, not individuals, nor governments in the majority of the world could afford. That put a spotlight on this very strange system of state-sanctioned legal monopolies. Through the years, and in the last 2 decades especially, the problem was solved in some cases through intense activism and pressure, and at the cost of thousands of lives, millions of lives when it came to AIDS. But then it only grew with the advent of monopolies on cancer drugs, and then monopolies on hepatitis C drugs, and then monopolies on cystic fibrosis drugs. It's a never-ending list with a never-ending list of victims in not just poor countries, but increasingly rich countries as well. When Americans started pointing out the absurd price of new cancer medications, again due to monopolies, when white middle-class British families started protesting over the last 5 years on the absurd cost of a life-changing cystic fibrosis medication that families who had children who were under the age of 10 needed literally in order to be able to breathe and then have a shot at a decent life devoid of pain for a few decades. And it had already become a global problem prior to the pandemic. But for those of us who had worked on this issue, trying to combat these monopolies and create a more rational and humane system of trade laws, of intellectual property systems, we imagined, I think at first, or I imagined, let me say, that the pandemic would be an opportunity to rethink this system, to see its failings, to understand the 20-year history that came before the pandemic, and to know very clearly from that history that a system of legal state-sanctioned monopolies on pharmaceuticals would not work to deliver access to vaccines in the pandemic. Instead, what happened, I think to everyone's surprise, to my growing horror, because I worked on this every single day of the pandemic, is that the system did not reform. Not only did it not reform, but it metastasized into a creature more complex, more powerful, with more monopolies. So we live in a state of vaccine apartheid. While in Germany right now, over 60% of all adults have received a full dose of vaccinations against COVID, while the figures in similar countries in Europe and the United States are in that region between 60 and 70%, while some countries have done even better, like Israel and the United Arab Emirates. You have the continent of Africa. Sub-Saharan Africa has less than 3% of its adults vaccinated on average. This is not only a matter of inequity, it's a matter of shooting oneself in the foot, because I think that the typical Western response to the pandemic, which has been let's vaccinate as many people, our people as we can, let's forget about everyone else, they can deal, unfortunately doesn't really work out. As you'll see in Germany today, or as you'll see in the United States today, in Germany now, nearly 100% of all new COVID cases, which are on the rise, are the Delta variant. The Delta variant came from India at a time, because I lived through it and I know this intimately, we had less than 3% of our population vaccinated. That led to a horrific surge with the most grotesque scenes of death and destruction over April and May. I lived through that. It was honestly one of the worst periods of my life. But the same situation can happen in any other society with our very low rates of vaccination. The variants that are created out of the monster mix of low rates of vaccination, inadequate hospitalization, then come back to countries which have been highly vaccinated and render all of that effort, the money, the effort to vaccinate over 60% of the adults, less effective. Now we know vaccines work. So even though there is a rise in cases in the United States or in Europe, it doesn't mean that people are dying at the same rate. It means that the unvaccinated are at great risk. And it means that the hospital system has to deal with the few cases that need hospitalization even after vaccination, even after being infected after a vaccine. Now, what it leads to is a state of panic. And that panic can be addressed in a couple of different ways. The way that the European Union and the US are choosing to address that panic is by authorizing booster shots to increase the immunity and the protection to people who are already fully vaccinated, while letting people who are unvaccinated, which as we all know is where variants come from, continue to remain unvaccinated. BioNTech, the shining jewel in the German empire of the vaccine industrial monopoly complex, is very much at fault in this system of unequal distribution of vaccines. 86% of all vaccines made by Pfizer and BioNTech have gone to rich countries. The rest of those vaccines have gone to middle income and low income countries. And the figure that's actually gone to the lowest income countries on earth is in the single digits. They're still better than Moderna, the alternative mRNA vaccine. 88% of Moderna's vaccines to date have gone to rich countries. This is a system of artificial scarcity. It's a system that has been growing and enabled by the states that house these multinational corporations that have created these vaccines with public money. The German government can do many, many things in order to vaccinate the world. So can the US president. In fact, the United States and Germany are the two best placed governments to take decisive action to do something about vaccinating the world. Why? Because not only did they fund the BioNTech Pfizer vaccine with your money, with your taxpayer money, up to the tune of something like $500 million in federal research grants, not for doses, just to underwrite the research. But they've paid out billions of dollars more in terms of pre-ordering and buying doses, including boosters. But the technology itself is being kept secret. The intellectual property is not being shared. What that means, unfortunately, is that of the 40 or 50 companies in India, of the numerous companies across the world, literally from places you'd never imagine, from Kazakhstan to Argentina to Brazil to South Korea to Indonesia, who could potentially make an mRNA vaccine, because paradoxically, even though it's the newest vaccine on the block, the newest technology, it's in fact the easiest to make. None of them actually can make it because the recipe isn't being shared. It's a complex puzzle, and I can offer more clues as to why the recipe isn't being shared. But I think that the point for now is that the injustice is that we are tolerating vaccines that have been funded with large amounts of taxpayer money in the United States and in Germany. We are tolerating those vaccines being entirely private property to the detriment, not just of the rest of the world, places like I work in, for instance, like India and South Africa, but to you in Germany as well, because our problems are going to come back to be your problems. And finally, that system is not going to work for you either. And it is inexplicable that we allow this situation to continue. And I hope to explore ways in which we can discuss the role, particularly of Germany, in solving this crisis.
Thank you, Achal, for this really comprehensive overview of this very complex topic. Thank you. Andreas, I think, when we talk about the, Achal called it vaccine apartheid. So, and also you as Medico have criticized, the nuances or the very explicit racism and prejudices in German discourse over the vaccine distribution. Probably before, I would also want you to speak about where you see the systematic problems that are being revealed through the crisis. But where do you see, racism in the debates, and how would you, connect this probably also to some post-colonial attitudes?
Yeah, thank you for this question that you put forward to me. I would say this is a very clear sign of this kind of bigotry in dealing with a situation when there is a scarcity of resources, and you have both the feeling of somebody is going to steal from us, which is very obvious in the case of the biotech technology, when the German government sees themselves as the defender or protector of keeping this technology to themselves. So in that way, and at the same time, there is this kind of perspective of the others are not able to produce it. So it was a very clear also word when it comes to how should the Africans produce these vaccines, which are so highly technologically. And interestingly, when you look more into the details, you find out it is not that complicated. It is, of course, new technology, and it has worked on for decades to make messenger RNA technology workable. And then when you look more into the details, as just a new report has been delivered by MSF, who really issued also some research by Imperial College from London, you find out it is much easier to produce this messenger RNA vaccines than the AstraZeneca technology, which you would need a much more controlled high-tech biotechnology lab. So in that way, interestingly, both sentiments at the same time are contradictory to each other. So on the one hand, you see that the German public feels that this is something that cannot be replicated by lower industrialized societies, which is actively playing a post-colonial sentiment. And at the same time, it feels that something is going to take it away from us. And this is something we need to protect. I think this is this way of the what we see at the moment in the current discourse. When it comes to the more structural causes, or that looks behind the problems on healthcare systems, it is very, very obvious that it is very close to the profit orientation that Achal has described on the level of vaccine or medicines production, but it is much more also something, as we see, is that this right to health and access to healthcare, this is enshrined in human rights covenants and the WHO constitutions. This can only be realized when it's the public policy takes responsible for accessible health services. I think this is maybe the crucial point when it comes to that the policies of the last decades of leaving social institutions, not only healthcare, also education, to the private sector, it means that the ones who cannot pay for health won't get it. And then this increases the inequities as much, because poor people have more need in healthcare services. So this is something that is a basic. This is something that this what we see, privatized health systems don't take responsibility other than selling their services to those who can afford them. This is the same with pharmaceutical companies, which are obviously singled out at the moment because of the need to distribute the vaccines much more equally. But it is the same with privatized healthcare services. We see this, and I think Achal could talk about this also in India, which has a highly privatized healthcare system, but also in Germany, where we see now more and more private companies taking over healthcare services. And this is something that contradicts this notion of the right-based approach to health. And this is what we see as the core problem in the whole debates.
Thank you. Yeah, I think that was in fall 2020. My colleague at ECCHR, Carina Theurer, she wrote an article where she well described how also the law and the intellectual property regime that Achal also described in the beginning, how this also clearly has a typical post-colonial sort of mechanism, because for one, it enables in some extent access to certain information. So it enables, if you look at, for example, indigenous knowledge about medicines, it enables the access, helps, well-trained lawyers and pharmaceutical experts to appropriate it, to formulate it in a way that it can actually be patented. And so then once that has happened, it falls under the intellectual property regime of the WTO and national regimes, and then that means you can exclude it. So it's a typical phenomenon of extracting and excluding then benefits, profits, and so on. So, and I think we should be probably also, and therefore, I'm very glad that also Medico is really confronting this racism that we have in our debate, that Germans are particularly proud of BioNTech without really acknowledging questioning whether it's actually legitimate to have property rights when it comes to knowledge that should benefit and that actually contributes to the right to global health, which should be a public good, and that actually cannot be appropriated. But Mina, you are a US-trained movement lawyer, and you decided, as a group, together with your colleagues, you've drawn together a network of lawyers from around the world, more or less, to be working on this topic and to be, developing litigation strategies. So, how come? How did you decide to go on this topic? And probably can you describe a couple of, challenges that we have faced probably on the way?
Sure. Well, thank you, first of all, for having me. Thank you to ECCHR, to Miriam, Wolfgang for hosting this fantastic series of panels, and I'm glad to hear that it's going to keep going. Well, to your question, after having practiced at the local level in the US for about a decade, it has become apparent to me that the human rights and racial justice violations that we see at the local level here are symptoms of root causes that are global in nature and therefore require global coordination to address. So when the COVID-19 pandemic began, it stood out alongside the climate crisis as one of the clearest examples of where transnational collaboration, solidarity, and strategy building would be necessary to identify solutions that didn't leave whole swaths of the world behind. But I must say that it wasn't until we were witnessing the devastation of the Delta variant in India in the spring, and a fellow lawyer colleague from there called upon many of us in the global north to take action that I actually began to work on the issue in earnest. And what that meant was leveraging the power and knowledge of the network I'm coordinating at Movement Law Lab, the global network of movement lawyers, which you have mentioned, in collaboration with other networks of human rights lawyers to begin to think together about how those of us in the global north could and should work together with our colleagues in the global south in pushing on our governments to support equitable and universal access to COVID vaccines, therapeutics, healthcare technologies as a matter of human rights. And many of us, as we began to meet some months ago, beginning in May, we felt that it was a moral imperative for us to act. And of course, as you mentioned, challenges, there are obvious practical challenges of, trying to figure out a strategy across jurisdictions where jurisprudence is different, where legal systems are different, where, human rights obligations under various international human rights instruments are also different, to come up with some way to piece together a strategy that doesn't so much focus on the technical IP arguments, but actually highlights and exposes the human rights issues that have come up in this pandemic. And so, I think one of the things that we see as we try to, shape claims and things like that is that there aren't any easy avenues, actually. And so much of what it is that we're, the obvious injustice is not so obviously litigated in courts or even before the human rights bodies. But I think many of us feel that there isn't an option to not say anything, and there isn't an option really to not try to push on these systems to really do what it is that they are supposedly designed to do, which is protect the human rights of people across borders all around the world. But the other reason why I think it's important to work on this issue is that at a more meta level, it helps us build the channels of communication and relationships across borders that we know are going to be necessary for future global crises. The more we exercise the muscle of international solidarity and transnational cooperation and collaboration, the stronger we will get in working together in the future. So we have to recognize moments as these as opportunities for us to construct something new and prevent the same kinds of injustices from happening again when, the next pandemic comes around.
Thank you, Mina. Maybe we can now discuss questions. Achal, also you mentioned that. So what what should we do now? So what could be strategies, right? So I think one strategy that Mina and also myself have been looking at is sort of how can we use courts? How can we use court proceedings? Potentially the UN system. As also Mina said, there are a number of challenges, and I think primarily, and I think I've never seen this with so much clarity and force, is to see that the intellectual property regime is so strong and so solid that it leaves so little room for individual persons negatively affected, not having access to vaccines, to actually challenge that. I think it's amazing how, I mean, so many lawyers have been spending months of thinking of something, and now we've come up with some ideas which, you know, are great but highly innovative and way beyond sort of normal litigation strategies, because there, you know, it's hard even to find a venue that, you know, where anyone would even have legal standing. So that's really amazing. So I think I will come back to that question also, what's the role of law in this? But probably now it's to Achal and then also Andreas. So, you know, what are your strategies? What do you think is needed now most of all to challenge government's positions, but probably also the general intellectual property regime or our health rights regime that we currently see globally? Achal, do you want to probably start?
Sure. Thank you, Miriam. Look, in the course of my work, there are lots and lots of difficult conversations I have to engage in about the role of the United States and Germany, particularly. And this is because I just want to make clear the power lies in the United States and Germany. If India had the same equivalent power, I have no doubt that we'd be behaving in exactly the same way. In fact, I know, because we are a sort of sub-imperial vaccine power ourselves. And the reason that we have now crossed a milestone of vaccinating more than 50% of all adults with at least one dose, which is an enormous feat given the population of this country, is because we suspended vaccine exports to 91 other poor countries. So 1/3 of the world, which was waiting for vaccines from India in order to vaccinate itself, are not getting those vaccines. They have not been getting those vaccines since March of this year because India has effectively usurped those vaccines. It's a complicated situation because I live here and have every sympathy for my family that needs vaccines. At the same time, I realize that the vaccines that my family, that my loved ones have received, in part have come at the cost of giving those vaccines to healthcare workers in sub-Saharan Africa. So I'm implicated in this as well, is what I want to say. But in terms of real strategies, look, I think what is hard, and it's a hard question to deal with when it comes to using law-based methods, is this idea that there is anything in the law that can compel the use of the power to make a government do something for another country. And I think this is a really interesting and complex tangle. It's not quite clear what the avenues are. I think that there are measures in the law that promote government action should government decide to do it itself. And so in the United States, where I know a little more about the way US law works, there are things like the Defense Production Act. There are things like government patent use. These are essentially emergency provisions that are encoded in the law, rarely used when it comes to things like government patent use. And when it comes to the Defense Production Act, very rarely used for anything other than, you know, guns and ammunition and radars and satellite systems and so on. But nevertheless, with ingenuity, possible to apply by a government to justify action to compel private corporations in their border to do something for another country. And there are precedents around this. And so there are some ways by which governments like the government of Germany and the United States can be compelled to take the kind of action that the corporations themselves within those borders are not doing. I think there are a couple of different ways in which the leverage exists, and one is moral. And the moral leverage is the fact that the research and development of these vaccines was funded by these governments. And that is the most significant lever, I think, that governments have to say that, look, we have a right to intervene in how this vaccine is distributed around the world. The process of vaccine development, which is the risk that companies take to make something like a vaccine, is what justifies, in a certain theory of economics, the monopolies that the vaccine manufacturers then have on that vaccine. But when the process has no risk because somebody else has paid for it entirely, not only paid for it, has actually, done more than just justify the risk by providing these pre-orders, right, which are then effectively a profit guarantee in advance. It's very difficult to justify why you would actually also need a monopoly in perpetuity virtually, at least in the short run, to then further make profits off something that was effectively funded for you. Now, the legal leverage that governments have, I think, as you said, is exploratory. It's not something that has clear precedents. It's not something that people have even thought about that seriously before. But there is, I think, one other lever which is really important, which is the popular will and the manner by which people asking for this of their government have, in the United States at least, managed to get what they want. So it was organizing in the United States around the Biden White House's stance against the TRIPS waiver, which was by default. They just inherited the Trump administration stance that did eventually lead to a consideration of what the US trade representative should do, which finally resulted in a cautious and limited but support of the TRIPS waiver proposal at the World Trade Organization, which would essentially waive in a temporary manner all monopolies related to pharmaceuticals, treatments, or vaccines in the pandemic. So I think popular will and being able to communicate that will to the government as the desire of people on the basis of them being owners of these vaccines, as well as, of course, the people who elect the government into power, has made a difference, and I think it can still do so. I do think, however, that this self-interest argument, which has been a little muddled sometimes, because I think in different points in the pandemic, it was never quite clear whether Germany or the United States could actually get away with just vaccinating itself and then leaving everyone else to be, right? Now, I think it's increasingly clear that you can kind of get away with it, but not fully, right? So what you're left with is a perpetual state of anxiety. Anxiety that translates into economics, by the way, because the anxiety of the Delta variant in Germany or the United States has a real effect on hiring, on the economy in general, on the political atmosphere in terms of whether vaccine mandates are necessary or mask mandates are necessary, et cetera, right? And I think that the self-interest angle is underexplored, and it should be, because there are ways to clamp down on variants, which is by cutting off the virus. And that can be done by vaccinating the world.
Andreas, you have been entertaining a campaign directed at the German government.
Yeah.
And probably explain a bit what that was about, what your demands were. I think it has ended by now, no? Or
no,
it's
we are still
going?
no.
Yeah. Okay.
We are
and
still
then also I would like to hear what do you think about, Acha said popular will. It's true, that is what needed, and I think that is something powerful to put governments under pressure, and I wonder, do we lack a bit of it in Germany? Is there enough, do you feel there's enough people we can mobilize on this topic?
Yeah, I think what we did do, or what we are still doing with our Make Them Sign campaign is very much what the title says. It was about get this waiver, this TRIPS waiver signed. So as a first step, as an important but first step only to really get vaccines production and medicines production globally distributed and available for all people. So this was more like I remember, I compare this a little bit to the Doha Declaration in 2002, 2003, when the HIV/AIDS crisis hit, and it was clear that the production capacities that existed already at that time in India explicitly must be needed, must be used for a global approach, for global access to medicines. And this was then put into negotiations at the TRIPS Council at the World Trade Organization. And at the same time now, it's a very similar situation. There are mechanisms within the WTO and within the TRIPS Council that you can waive for a certain time, for a certain moment, these patent laws. And when and this should be a very clear moment when this needs to happen in such a disaster. And I think this is a bit like the push, or what we try to push in the German public and as part of a European and global network. So we are not doing this in Germany alone, but we do it particularly in Germany because the German government has this very stubborn position at the moment to say, okay, it is nothing to do with the patents, it is just a problem of technical bottlenecks, and we rely and we believe our companies to do the best that they can. And this is an absurd situation in a society that knows that the economy is organized in a competitive way. And of course, companies will just act in their own interest rather than in the public interest. I think this hasn't been caught really sufficient public attention in Germany. Interestingly, we have three parties, like even the Social Democrats and the Greens and the Left Party, who said, okay, we are for this patent waiver and we are for technology transfer. And so in that way, we have, like if you see it from constituencies, a bit like half of the society on our side. And even in the conservative field, beyond the purely neoliberal party, the FDP, the idea that it is necessary to compromise on this, and also in your own interest, because you have to beat the virus everywhere and not just in your own country, is the mantra of the day. But interestingly, and then this, I would say, shows the weakness of the public policy, that they were not willing or not able to really enforce mechanisms, as Achal said, to say, okay, if we pay for your research and we pay public money for and give you guarantees for selling when you develop this thing, then of course we demand that you put the knowledge in the public sphere. There were mechanisms like the COVID-19 Access Technology Pool of the WHO, which is still today empty because this was not happening. And I think this also shows on the other side, and we are still pushing for it. I think the trade negotiations are very slow processes. That's always a problem. And I think this doesn't fit with the dynamic of a pandemic. That's what we see very clearly at the moment. There will be a ministerial council meeting end of November at the WTO, which probably will be the moment of some kind of decision. And we will continue with our efforts at least to this point to really make enough noise, and we hope that the new elections that are coming up end of this month will produce some new results. Never know if end of November we have a new government, that might change something in that work. So this is that what we do, and we know it is a really joint effort globally, and this is what is part of what we have learned from the AIDS movement, I would say, from the 2000s, that we can mobilize the public, and we also can use legal mechanisms in this moment, even if I'm not an expert on this. But I think this is something that we were able, and this is something that is really different from the years I remember from the 2000s, early 2000s. This took much more time that time to really come up to the point where we had a medicines patent pool. And it took just weeks last year to really mobilize around such an issue. And of course, it's still too slow, and we still feel unnecessary deaths are coming and happened because the global community could not agree on a really joint strategy, but they would rather, and this is also the sad story of it. The global community was content with the concept of saying, okay, let's have one big Indian company produce all the vaccines for the global South. And if this is not working,
during AIDS, you mean HIV vaccine?
no, this was the COVID-19 vaccine,
Okay.
the India Serum Institute with a cooperation with AstraZeneca and the Oxford campaign. And if this mechanism just for some good reason also got broken because India were desperate in needing to vaccinate as quickly as possible its own society, how are we to blame India for closing the exports? But because our neoliberal economy functions like this, so that we say, okay, we have the one hub here and the one hub there, and we have not developed mechanisms to quickly distribute also production capacity. And this could have been happen in the last 15 months.
Yeah. Thank you. Mina, so one small question and then a bigger one. So one small question, Achal said that we should be exploring the self-interest angle more in bringing into the public debate. We also discussed that if that shouldn't also be a legal argument to say governments are obliged to protect their own population and therefore the rest of the world needs to be vaccinated. I find that, I always have a little bit of a stomach ache with that because it sounds like, yeah, I just want to make sure that, I'm even better off than already now, here in Germany. But why, Mina, what is your opinion about that one? And then more broadly, probably, you started to describe this, but I think, where do you generally see the connection between movement lawyering and then the transnational lawyering? So, and I think you started to describe this, but I think you can take a bit more time of elaborating on this. And yeah, I think probably also, as Andreas said, maybe we also need to see it as, at least this time, probably we need to rehearse this as a global community to be quicker as civil society with every challenge that comes. I guess otherwise we totally despair with all the, with all the deaths and crises and the devastation we've now seen in the COVID crisis.
Yeah, no, thanks. And thanks for bringing that question. It's, I think the self-interest argument is a pragmatic one, but it is a morally and politically just uncomfortable argument to make, because at the end of the day, I think we want to be moving towards a society and a world in which we do see our lives and our own rights to be interlinked with those of others in the world. And in fact, our human rights treaties and obligations do say that we have to do the most in our power to ensure that we are not violating the rights of people extraterritorially outside of our countries, and that we are committed to international cooperation and finding solutions to issues that are systemic in nature, where the rights of millions of people across the world are being impacted by particular political positions or particular issues. And so I think that for us as human rights lawyers, I think that we have to make both of those arguments at the same time. Yes, it is a reality that people's health in Germany, in the US, and other places is impacted by the proliferation of variants across the world. And so in that very sort of practical sense, yes, our lives are impacted by the low rates of vaccination elsewhere in the world, but we should also talk about this as a not just a matter of self-interest, but as a matter of the upholding the principles that underpin our democratic societies, the principles that underpin many of the, as I said, the human rights obligations that states have signed on to, and that also are going to be very necessary when it comes to other crises. As I was mentioning earlier, the climate crisis is threatening us in different ways across the world, and that is not a crisis that can be dealt within any one country's borders either. And so, as we see crises like the pandemic coming up, we need to actually come up with a legal regime and reinforce a legal regime that supports international cooperation, so that we don't let states just kind of ignore their human rights obligations, but actually we hold them to account and strengthen those mechanisms that provide redress and remedy for systemic rights violations. I think, when it comes to the connection between movements and law, I mean, as Achal and Andreas were saying, the other side has the sort of legal regime on their side. They have the economic resources, they have the political connections, and we on the side of the vast majority of the global population don't have those things on our side. But and so our legal strategy must be anchored by organizing, but anchored by expressions of people's will, and so that's where movement lawyering comes into the picture. It's sometimes called community lawyering, law and organizing, people's lawyering, but it's founded on a theory of social change that recognizes that activism and social movements have always been the driving force of social change, and when people who are similarly aggrieved get together and fight to change systems producing injustice, then it's our role as lawyers, lawyers of conscience, human rights lawyers, lawyers seeking transformative change, to support those movements using the legal tools that we have at our disposal. Oftentimes, existing legal regimes and frameworks, as we say with the IP regime, which are shaped by powerful interests, such as big pharma companies, corporations, the law is part of the problem, and it provides cover for unjust systems and structures. And so, we lawyers who recognize this can use our knowledge of the law to support movements in changing policies and transforming institutions to protect the rights of the many who are currently disadvantaged by unjust systems. And the medicine system, as Achal and Andreas have put it so well, is one of those unjust systems. It has been influenced by big pharma companies, the private health industry, in such a way that it serves their interests over the interests of the broader public. And so for us, when countries in the global South stand up with rightful indignation about the unconscionable way that governments in the global North have hoarded the vaccine supply and protected the interests of big pharma, we as human rights lawyers must figure out how we can use our skills to support them. So that's where we come into the picture with doing what we can to support the efforts of people on the ground, the People's Vaccine Alliance, and other efforts to achieve equitable access to COVID healthcare technologies. I mean, I have more that I can say, but
no, thank you. That's great. So we are now receiving questions also from the audience, and I think there's one legal question which I would again direct to you, Mina, and that is there any legal leverage to defend groups that are being denied a fair access to vaccine, for example, in India, or can you imagine such litigation in the future? So, briefly, explain us some ideas that probably you have.
Yeah, well, it's not just my ideas, but ideas from Miriam and many of the other lawyers that have been getting together on this. I mean, as we were saying, this issue requires a high level of coordination and transnational collaboration across the global North and global South. And so the hope is that, people who have been denied this access, or people who find themselves in a situation where they are able to show an injury because of states like Germany and the UK and Canada and others' refusal to support a TRIPS waiver. If we can show that that injury is also linked to the refusal of these countries to support the waiver, which we think is a violation of human rights obligations to the rights of life and international cooperation, then we think it's a worthwhile claim to bring in any forum that where this claim will be able to be litigated. And of course, like as you were saying before, Miriam, I think the question of a forum is a tough one, because as we were saying, there isn't a clear path. However, that is the kind of claim that we have to be willing to take and to reinforce the importance of following human rights obligations.
Yeah, thank you. I think another question that we have here is probably for both Achal and Andreas, because it is a question, I guess, where lawyers always think that law is most important and arguments of rights is most important, but I think probably you have maybe a bit of a different perspective. And the question is, where and how would it be possible and strategic to argue that privatization of healthcare services is a violation of human rights? So I guess in that question lies also, is it possible that at some points it's not a good way to argue? Andreas, do you want to start, and then Acha?
Yeah, what I think maybe starting from that point that privatization, to show the effects of privatization of healthcare services. I think if privatization means people who cannot afford services cannot access them, then this is a clear neglect of their right to health. And this is the access to healthcare services should not be limited to the ability to pay. This is a very clear legal argument, I think. And the question has been always raised how big this portion of healthcare services is legitimate that people can demand from the public, from the state, from their own state, because it doesn't exist a legal responsibility for extending this globally, to what I know. That's a bit, that has been always a problem. And then this was always this argument of the progressive realization of rights that would give states a loophole to say, okay, we are working on it, but we have not reached it completely. But when you go back from an existing public health system through a privatization strategy without assuring that everybody is still having access to these healthcare services, that might be an idea that I could think of, to say, okay, this kind of privatization needs to be drawn back. But even in Germany, as we see some ways of recommunalization or republicization of private health services, I don't see that this has been used much as an argument on a violation of human rights. But
Achal, what do you think? So you do in your advocacy, do you find the rights argument a useful one or a powerful one, or do you not or is it not probably much more about, I don't know, convincing the powerful, no, or convincing the policymakers? But yeah.
Yeah, no. Look, the rights argument is very powerful. But let me give you an example, a concrete example of this. When I mentioned self-interest a little earlier, obviously that's not because I think that vaccinating the world is not the right thing to do. I mean, I obviously think it is. And we found that we've reached the limits with some of those arguments. And so we're also trying to make it as broadly as possible to appeal to as many people. But I think a part of the self-interest argument as well, when it comes to monopolies on pharmaceuticals and vaccines, is that they really only affect people who look like me or Black and brown people, right? which has been the dominant theme of the access to medicines movement over the last 20 years. When I started working 20 years ago, it was inconceivable that Germany had a problem with access to medicines, or that monopolies could cause a problem with access in the United Kingdom. And yet, just 2 years ago, just a year before the pandemic, I was working almost full-time on a case involving a cystic fibrosis drug that the National Health Service, one of the best funded public health systems in a country with socialized medicine, in one of the richest economies on earth, could not afford on its own guidelines. It has guidelines that evaluate the cost of a drug versus its benefit, could not afford, or can be, the first ever treatment for cystic fibrosis, to tax-paying NHS funding patients who lived in the United Kingdom, who were not even poor, they were middle class, right? And they could not afford it themselves. The NHS could not afford it. That standoff lasted 5 years. So this idea, I think, that pharmaceutical monopolies really they might disproportionately hurt us, but they hurt everyone. And I think that's part of the larger self-interest idea that I think I'm interested in thinking about, which is this idea that, for us to democratize Pfizer-BioNTech technology, it is something that we must do solely for the rest of the world. It is something that is ultimately in Germany's self-interest to do for Germans and for the public health and continued well-being of people within Germany, because this is, the snake that's in your backyard, yes, that eventually bites you. This has happened repeatedly. And I think that is very clearly a violation of lots of things, including rights, which I think can very much be litigated domestically and successfully.
Thank you. So I think we have another very technical question, which I think need to be, or I don't know, Achal or Mina can choose, which is, so how much would compulsory licensing, which Germany has been advocating for. So I think that what it means is that every national state should be issuing a compulsory license. Let's say South Africa issue compulsory license so that they can get access to the BioNTech patent, and the same for Mali and Indonesia and so on. Would it be would that be more effective in comparison to a TRIPS waiver for making vaccines accessible? What's the difference of those two approaches? I don't know.
I'd be happy to take a stab at this, just because I am particularly enraged at this European Union proposal, which is to increase compulsory licensing. One of the things I just want to say I appreciate about Merkel and Germany is that she said, no, I don't believe in the TRIPS waiver. This is bad for Germany. This is the bedrock of our economy, which now I think BioNTech truly is. I think now it constitutes 1% of the German GDP. The European Union, the way that the European Union said no at the WTO was to say, this is not a no. Think of it as a counter proposal, which is meaningless, because the counter proposal is, let's make compulsory licensing easier. Compulsory licensing, which of course the European Union, along with the United States, has bitterly fought through sanctions, through threats, through every kind of bilateral dissuasion that they could do to any country that wanted to use it over the last 25 years, right? Now, they want that process to be made more easy and put to use for vaccines. So firstly, it's ridiculous. Vaccines are biologics as compared to antiretrovirals, which are small molecules, which are simple drugs, and then these are complex drugs, right? The small molecules, they have, maybe 5, 10, 15 patents surrounding them that you have to crack, and really only sometimes one significant patent on the molecular entity itself that needs to be compulsorily licensed. When it comes to vaccines, there are something like 200 patents surrounding them. Many biologics have literally patent estates that are in the hundreds. Those are a combination of patents that the company owns, a combination of things that have been licensed and sub-licensed, and then, very complexly made estates. To identify patents surrounding a particular vaccine, I guarantee you would take you 6 months. To litigate for a compulsory license on all of those 250 patents, then, and simply to even identify who you would be litigating against in order to get that compulsory license would take you another couple of years. And this is not something I'm making up out of my hat. These are very difficult, complex, bureaucratic processes to run. Even if you were to compress them into a couple of months, you're still having to do it 200 times in order to get one permission to make one vaccine, right? It is the most ridiculous counterproposal. It is not a counterproposal. It's actually a very polite way of saying no with, typical passive aggression. It should not be even treated as anything similar to the TRIPS waiver because it's not.
Thank you for this very clear answer. Mina, yeah, you want to say something?
Well, just a very short addendum to that, just to say is I don't even know that it's polite. To me, it sounds it's rude and it's in bad faith because it's so clear that compulsory licensing is a inefficient and long route, and it's that the European counterproposal seems designed to protect big pharma interests.
Mina, there's another question for you. And I think then I will have one last question for all of us to wrap up. But the question to you, Mina, is regarding mobilizing popular will. What previous experiences of movement lawyering can inspire the efforts? I think we've heard about the campaign for the HIV medicines, which I think you described as an inspiring example. Mina, from the lawyering field.
Yeah, I mean, I think that sometimes law and organizing can act in concert, and so I think sometimes filing a lawsuit can also help bring actors together on the ground. But I think primarily we like to try to work together with organizers and with people that have already developed a set of demands to then provide additional support to those campaigns by using legal means. So it may be that the organizing is just a spark, and then it is the addition of media, it's the addition of a legal strategy that together then helps produce the groundswell and the sort of public dialogue necessary to push for a different solution, to push for acceptance of the demands of the organizing. But in terms of other campaigns, I think the ACT UP campaign, which was around AIDS, HIV in the U.S. Silence is death. That's really inspiring in this particular on this particular issue. But then, of course, there are many other movements. There's the Black Lives Matter movement. There are movements for the housing justice, and lots of movements that use a sort of complex set of tactics that are include law, but also include grassroots organizing, media work, cultural work, and many other things to really shift public perspective and public dialogue on these issues. And so that's the kind of groundswell that I think is really important here. And I see it happening in many places, but it does need to be louder. And I appreciate the efforts of Medico in Germany to do that, and we hope to continue to support them, as well as other movements in really bringing out the stories, the real life experiences of people who are whose lives are being impacted by the callous refusal to support the waiver.
Yes, thank you. So yes, let's come to our last question, which is also from the audience. Which concrete measures would you like to see? I add to it, in an ideal world, from the German government. So let's say after the elections, end of this month, we have the ideal government. What would the German government do? Andreas.
So of course, first to sign the waiver, which would accompany. No, the most important thing is probably really to put his authority behind really, and not making the companies to cooperate with the existing international structures to really make vaccines as quickly available as possible. Being in the WHO technology transfer hub that is now being started in South Africa, to make very clear that BioNTech and CureVac and whoever in Germany holds crucial technology on this needs to cooperate with this fully, and pushing this, even if they cannot enforce this legally because they hadn't put it in the names. This is the one issue I would like, then signing the waiver, obviously. And also backing this technology transfer with some substantial funding that really give a showcase that this makes it possible. And also stopping using these arguments that patents have nothing to do with the scarcity of vaccines. I think this also is in the discourse, of course, very persistent in the German public still. So this I would wish.
Thank you. Achal.
I'm going to go a little further to add to what Andreas has said. I think if we were to think forward, and it's hard to do that in the middle of a pandemic, but I would like the German government to understand that pharmaceutical monopolies are a bad, inefficient, and cruel system of giving us, Germans and the world, new medicines and vaccines, to abolish it and replace it with prize funds, with any number of alternative methods of rewarding and incentivizing pharmaceutical innovation that works for Germany, that works for the world, that democratizes the production because there aren't monopolies associated with new pharmaceuticals, but also allows states like Germany to actually do more, like to find out, for instance, whether one Pfizer dose works better with one AstraZeneca dose than two Pfizer doses, right? There are so many things that we can't do, that we don't know among all of these competing treatments because they're all privately owned. Now, if they were publicly funded, and in fact then publicly manufactured, states, medical authorities, they would have so much more power in deciding what truly is the best set of treatments that we need as people who funded this. So abolishing the system of monopolies, that is what I'd hope for.
Thank you. Mina.
Well, I agree with everything that has been said before, but I guess I would add to that, looking forward, there has been a proposal on the table, and I don't know how popular it is politically, but I'm really interested in an international pandemic treaty. So legal frameworks that help to codify some of the things that Achal is suggesting that we do going forward to prevent the kinds of dynamics that we see coming up now. It should already be in a matter of international law that states cooperate together, that the knowledge and technology on how to produce these publicly funded vaccines and therapeutics should not just exist in private hands, but they should be able to be leveraged by the international community, working as in concert with each other to address what is a global issue. So I think I would just say, in addition to what everybody else said, I think Germany could show great leadership at the international level, both in terms of the TRIPS waiver, but also in terms of helping to put into place enforceable international legal obligations going forward that we can then use to actually litigate and protect the rights of the vulnerable.
Thank you.
Of everybody.
Thank you. This has been a very, very inspiring last round, despite all the bad news we usually receive when it comes to the crisis and government's stubbornness of effectively wanting to deal with this. I want to thank you for your attention. I really I think what I'm taking away is, once again, how many bad arguments that apparently seem scientific or very reasonable, with how many bad arguments the debate is really being poisoned in Germany, but also worldwide. I'm very glad that Achal and you, Andreas, that you once again raised some of those issues where the public is also oftentimes really misled. And I want to thank you, Mina, for also pointing out that the human rights obligations that governments have to the global right to health, that it also involves the obligation to international cooperation. And I think that is something that is enshrined in the International Covenant for Economic, Social and Cultural Rights, but that is actually not invoked enough. And when should it, in a pandemic, that's probably the time where it's most timely to actually talk about this much more, and also to use law and the rights argument and legal procedures as a way to make voices of those that suffer most heard. No? So I want to thank you for that part. So thank you again for being with me. Thank you, Achal, for bearing with us so late into the night. Thank you. And now I want to remind our audience that we have another event on September 22nd with Ben Hayes, Isha Khandelwal, and Wolfgang will be moderating the panel. And I think if everything turns out well, they will all be sitting in presence here on this panel. So no one will need to be on Zoom if COVID and circumstances allow. So thank you again.
Thank you, Ben.
Thank you, Miriam. Thank you, Andreas.